I'm very excited about the Patient-Centered Diabetes Care Symposium. I think the first thing that I'll focus on relates to the need for patient-centeredness when we're dealing with specific disease states like diabetes. And I think there are two dimensions to patient-centeredness that I'd like to focus on. One is a physiologic or a clinical perspective, which not only relates to diabetes and sugar control, but in a more sort of holistic and comprehensive way, the other components of diabetes management that relate to comorbidities and complications that can occur in the diabetic. So issues like lipid control, blood pressure control, smoking, activity and exercise, which fundamentally can alter the well-being of a diabetic patient. The other dimension, I think, relates to the behaviors and engagement of the particular patient. So from a clinical perspective, we can access the best evidence and the best technologies to define an optimal clinical path for a patient. Having said that, if the patient isn't adequately engaged and adherent, then all of our efforts are really for nothing. So I think there's a real need from a behavioral economist's sort of perspective to make sure that patients are engaged and are complying with the guidance that we can generate on the clinical side.